There is a big debate on whether you should really use a robot for surgical procedures. In our institution, we use the robot now since 8 years, and we see tremendous differences in blood loss and in OR times, because we are now putting patients with different indications into the robot theater, and we are able to compare the same procedures to what we have done before. And blood loss and pain management and hospital stay usually is improved by the robotic techniques without really getting disadvantages in terms of not being too radical or having more complications. The complications are different as compared to open surgery, but the advantages is the bloodless, more or less bloodless surgical field, that you see much better because of the special cameras and 3D vision, and also that every normal surgeon is able to be educated with a robot, because you can sew and preparate your stuff in the surgical field like you're used to it in the open surgery. So in a detailed comparison between open and robot, we have lack of data. There are no head-to-head comparisons in most of the procedures. This is due to the fact that most patients demand being operated by help of a robot, and that only a few patients really are willing to be randomized to open surgical procedures. However, this should have been done in the beginning, so my view is we should have firstly explored the robot and the potential benefits before we put it into patient care. But now the time is over. I think it's many indications we really are not able to really compare robotic approaches versus classical surgical ones. Well, most of all, you have to analyze what you are used to analyze in the past. So this means, for example, the rate of positive margins in surgical procedures, the OR time, the blood loss, pain management, all these are objective parameters. But most important, after all, is patient-reported outcome. So we as clinicians tend to measure things that are only valid for the first 1 or 2 weeks. But for the patient, it's important how he's getting back to his daily activity, for example, or what about 1 year after surgery? Can I do all the things that I'm used to? So for the patient, it is not really important how many blood loss there is and how is the visibility and the surgical margin rate, as long as it doesn't transfer into tumor recurrence. So I think the patient-reported outcome data are really missing in robotic surgery. And I think we, as clinicians, should ask the patients regularly and prospectively to report on this.